Thank you very much. Questions for Professor von Mutius? Sorry, Jeff, you want to go?
Can you estimate how much it costs to share data? Did each of the people involved have to have someone whose full-time job this was? Was this a part-time job for someone? Was it actually very easy, or was it complicated enough that you really needed to devote a lot of resources to it?
I mean, if you take a researcher time, 2 years, you would be 160,000 euros. And then if you would think of all the, I mean, there's lots of costs that you cannot really quantify. Meetings, travel to meetings, talking to people in each of the single studies involved. That's, I think, as much as I can tell you. And
we just heard a lot about informed consent. And I keep on looking for examples where there were people who, from whom informed consent was obtained, who later complained. Realized that they didn't realize what they were getting into. Have you had any examples of people who said, oh my gosh, I didn't realize that my data were going to be used this way, it's terrible?
I mean, in Germany, with my IRB, we have the same, you know, all the IRBs have slightly different interpretations of things. My IRB forces me to say with whom I share the data. So that's another issue. Not every IRB wants me to do that, or wants people to do that. So I didn't have any problem, but we had to be very specific. We had to say we do research for asthma and allergies in children, nothing else. We share the data with YXC, and that was one of the difficulties in this GWAR thing, that all of a sudden here was Imperial College involved, and as for some of the centers who didn't have that sort of information. But I personally never had, so far, never somebody complaining to me that it did not happen. I completely agree that I think lots of this is not read. We try to have these short forms, but once you get into data protection and data sharing, they get 3 pages, 4 pages. People don't read that anymore. But we have the right, in Germany there's the right to, we have to offer them the right to get out of the study if they want.
Finally, did you have many people who didn't want to give consent because of their
Yeah.
widespread availability of the data?
Well, you don't know why they didn't give consent, but in these population-based studies, 30% of people are willing to share all the data. That's about it. We don't pay them. Again, it's population-based studies. It's not clinical trials. It's children and their families. So if you say you want to have environmental samples, genetic information, all the stuff, you're down by about 30%. We had, therefore what we did, we have a recruitment study where we said, you know, are you willing to participate? And we have some information of who the participants are. And for the main outcome, so we know how biased this thing is. So fortunately, in our case, it wasn't that biased, but that's, you know, that's what you usually calculate if you want to have everybody on board. 30% is what we get.
Other questions? Could I please ask you a question? You sort of made a good point that we haven't really talked about issue of children in research and the added complexity. Could I ask you to say a little bit about the right to withdraw from a study if a child who was too young at the time of the original entrance into the study later reaches some threshold, either age of majority or a lower age, where they're thinking about this and says, I want to withdraw from the study. In Germany and elsewhere in Europe, are they allowed to do that? We heard, I think it was Pearl, or somebody said that the FDA does not, David, I think it was you, does not allow people in a clinical trial. You can't withdraw the data that was collected before the person withdrew. So you can refuse to continue, but you can't sort of extract. What's the situation in Germany? And
well, there's no clear regulation, but I think that's the general feeling. We had one study where we did a follow-up of where parents had consented for the children to be in the study, and we did a follow-up, and then they became 18 and older, and so then they had to give their own consent. But for the period before, it was clearly the parental consent that was the important one. But again, I mean, we ask the children if they, you know, if they want to give blood, they have two little crosses. And so one of the discussions we had, how old are these children going to be? And how do you explain this to them? So we had leaflets for the children per se to describe the study as much as you can describe this for a child. But if the child at the day of the blood sampling would refuse.
Right. If there are no further questions, I want to thank you, Dr. from Mutius, and let's give ourselves a break and reconvene at 11:15. Thanks again to all our speakers this morning.